government departments, and ladies and gentlemen, let me start off by apologizing for the logistical challenges that many of us will face as we came in, particularly the security. This was given rise to by complying with all these restrictions that we have announced about the numbers of people. But let me immediately express my thanks and gratitude to all of you for honoring us through your presence here. It's just over a month since I last had an opportunity to meet with our country's faith leaders. Then we were dealing with how we can, as a nation, address the challenges our country faces in relation to issues of the social fabric of our nation. That was under very different circumstances. Then, as now, we were motivated by the firm conviction that the faith community can play a critical role in resolving our most pressing challenges. Given the position of influence, of impact, and of authority that our faith leaders occupy in our society, we would like today to discuss with you as the leaders of our people on matters of faith and how we can work together to discuss one of the most grave public health challenges and emergencies that our country faces. We've been having informal discussions with a number of you about the measures that we need to take. Today's meeting gives us all an opportunity to have a more formal engagement on this challenge. Where we were not able to consult with you on certain matters, we hope that you will understand that the urgency that we've been working under has made it difficult for us as government to touch and talk to each one of you. And if by not doing so we have erred, we would like to apologize. But our intentions have always been positive, have always been to advance the interests of our people as a whole. Yesterday we had a most wonderful similar engagement with leaders of all the 14 political parties represented in our parliament. They all agreed to rally behind the interventions the government has announced. As you know, on Sunday we declared a national state of disaster in relation and response to the outbreak of coronavirus, COVID-19 as it's called. Over the past few days, government has begun implementing a wide range of emergency measures to scale up screening, detection, and to limit and contain the spread of the virus, but also to support the healthcare system in dealing with those who are not well. You will all be aware of the measures we announced relating to restrictions on travel, border closure, school closures, quarantine measures and protocols around social distancing and hygiene control. In the light of the measures announced to encourage social distancing in order to curb new infections, there has been understandable concern expressed by members of the faith community on how this impacts on their work. Attending daily, weekly, and monthly religious services is an integral part of life for millions of our people around the country. We are keenly aware of the important role congregational worship plays in giving solace, comfort and strength to the men and women and children of South Africa. This is a practice for which we have the utmost respect. It is part of our tradition, part of our rituals, and we respect that. At the same time, we are faced with a stark reality. The undisputed reality is that this virus is spread through human contact. In limiting the size of public gatherings to no more than 100 people, we want to ensure that there is containment of the virus. We do this because we have seen elsewhere in the world just how quickly the coronavirus can be transmitted from one person to another with even the most limited contact. In one country, it has been reported that when people congregated in one place, that represented 60% of the spread of the virus in that country, just through that one gathering that took place. In response to government's directive, a number of faith communities have announced on their own that large communal services have been suspended or cancelled and either restructured to allow for smaller services or called on people to worship at home instead. We are aware of the challenge this presents to our Muslim community and the requirement to worship 5 times a day. We are encouraged by the ongoing discussion among representative bodies to encourage worshippers to limit congregation sizes and to use alternative venues to mosques. It is noteworthy that our faith communities are also harnessing the powers and the effectiveness of technology, announcing that services will be live-streamed even through mobile phone applications. I have seen the announcements from many faith communities encouraging proper hand washing, stopping handshakes, encouraging the elbow greeting or the hand wave. Some have moved to the sterilization of instruments that are used in religious rituals, and proper procedures have been put in place to follow when displaying flu-like symptoms. The measures being taken are in line with those already in place elsewhere, including in the Vatican and the Holy Mosque in Mecca. The measures we have adopted are in the public interest, are in the end aimed at saving the lives of our people. And we thank you for understanding this and for encouraging your respective communities that they are given accurate and timely information. In announcing the national state of disaster, I said that extraordinary times call for extraordinary measures. We have to carefully weigh the need to protect the public from coronavirus with ensuring that disruption to their lives is also reduced. It is also necessary to clarify that the regulations around gatherings over 100 people also apply to weddings and funerals, over which our faith-based leaders always preside. We call upon you to engage with bereaved families in the preparatory stages to impress upon them to confine the burial congregation to only those who are close to the family that is bereaved wherever possible. We know that this is a particularly sensitive and difficult subject to manage. And as government, we will continue to drive the message out there that there really is no event that is exempt from the regulations. The regulations were published in the Government Gazette just yesterday, and they have now become the law of the land. During April, millions of our people traditionally make their way to various domestic locations for religious pilgrimages or holy sites abroad, as our Muslim brothers and sisters do to Mecca to perform the Umrah. As government, we wholly appreciate the challenges that this presents on a number of fronts. The announcements by the Methodist Church cancelling Good Friday and Easter Sunday services, by the Muslim Judicial Council that the Friday prayer has been cancelled, and by the Zion Christian Church that the annual Maria pilgrimage has been cancelled, were no doubt reached through great difficulty. And we know that the leaders of those faith-based organizations agonized quite a lot before arriving at those decisions. This is something that we keenly appreciate. I want to assure you today that as government, we are working with speed and urgency to restore the country to normality. Our focus is on keeping people safe and healthy. As faith-based leaders, you have shown your support for the national effort, and we thank you for this. I'd like to call on you to extend your cooperation with us as government in reducing the impact of the coronavirus across all sectors of society. Millions of South Africans are at risk of contracting coronavirus, not just in places of worship, but in buses, in taxis, in trains, in train stations, in the workplace, and even in their homes. This risk is greater in poor communities, many of which do not have access to safe and clean water, and who are forced by circumstance to live in close proximity to one another. Given the high prevalence of HIV and AIDS and tuberculosis, COVID-19 could have a devastating impact on our society. The Department of Health has developed communication tools that clearly spell out what constitutes hygiene control and what to do to minimize the risk of infection. I encourage you to take and to make use of these and affirm them, not just in services and gatherings, but in your own pastoral work. This is all the more important when it comes to helping and supporting those who are already infected. Caring for the sick and reducing social stigma is a common thread to all religious faiths, and I call upon you to be part of the effort to ensure that those who need help get it, and that those who are already ill are not shunned by their communities. And in this regard, I know that this is part of your remit. This is part of your task as faith-based leaders of our people. In all the work that you do to care for the poor, the elderly, and the vulnerable, you do always take precautions to care for all those who are vulnerable. And in this regard, we're also asking that we all urge our people to take precautions to prevent the spread of the disease. A critical part of our prevention effort is putting tracking mechanisms in place so that those who have been in contact with an infected person are alerted and can present themselves for testing. We are working with technology-based companies as well as health entities who are cooperating with government to upgrade our tracking capabilities so that we're able to track, monitor those who are infected. And in the same vein, we're also having to deal with strict quarantine measures that needs to be followed for those who have tested positive. And we have called for those who have been in high-risk countries to ensure that they self-isolate. We call upon you to use your public platforms to educate people about quarantine and what it means, but also to pave the way for those who emerge from quarantine places to be reintegrated back into the community. Our experience with HIV and AIDS epidemic shows that faith communities can play a critical role in breaking the stigma surrounding illness by educating our people. This includes raising awareness that anyone can be a carrier of the virus and that it is not limited to certain nationalities or races. I call upon all of us, whether we are from the traditional healer community or other sectors, to play a prominent role in this regard, because millions of our people consult across the board for spiritual help as well as for health assistance on all these matters on an ongoing basis. Aside from observing social distancing and hygiene control, including during the initiation process, let us use the relationships of trust that we have with our patients to promote personal health and safety, especially those who have compromised immune systems and who are also very vulnerable. Similarly, you also have a role to play in dispelling misinformation and false news, and may I say fake news as well. The Department of Health provides regular, accurate and updated information on what we need to know, and this should always be our first point of call for correct information. There is detailed information on how the virus is spread, on who is more vulnerable, and what we can do to contain it. The National Command Council, which is coordinating our country's effort, will also be regularly reporting back on the implementation of the emergency measures. We continue to count on your support in driving the messages of social distancing, hygiene control so they reach every corner of our country. While we are gearing up to manage screening and detection on a large scale, our public healthcare system will struggle to cope with millions of people presenting themselves for testing without due cause. There are difficult times that lie ahead for our country. Over the next month, millions of our learners will be out of school and at home. For many, this will mean the loss of a nutritious meal or a place of safety during the day. Parents who work will worry about who will be taking care of their children, especially in communities experiencing high levels of poverty and crime. The impact on the economy will also be very significant. Potential business closures or downscaling will lead to a climate of uncertainty in the workforce as people worry about their jobs and about finding employment. This will exacerbate the already precarious situation we are in. Students whose classes have been suspended will be concerned about whether they will be able to complete their academic year or graduate. People in good health will be worried that they may have symptoms, and those with compromised immune systems or ill health will fear for their lives. In such times, it is you that they will turn to. It is you that they will look for reassurance, and it is you that they will look for to comfort. It is up to you that we too tend to spread the messages I have outlined and to inspire confidence amongst our people. You will be required to be the emissaries of hope. You have always been in giving strength to those flagging in spirit, comfort to the sick, and champions of social justice. This disease knows no boundaries or race or class, but it is the poor and the vulnerable who will need us most. I would like to think that the Tumamina moment is truly upon us, perhaps as never before. Let us keep the nation's spirit up and remind them that we are doing everything within our means to keep them safe. We are in this together, and it is by working together that we will be able to prevail. As we will be entering discussions now, I would like to put a proposition which a number of people, including amongst yourselves, have been putting across. That is, at a moment like this, particularly because the majority of South Africans are driven by faith in everything that they do, whether we should not think, some have suggested, of a national day of prayer, setting aside a portion of the day, an hour, few minutes or whatever, where the whole nation will pause wherever people are, in their homes, in their workplace, wherever they are, pause for a moment of prayer, for a moment of reflection, and for a moment of giving solidarity to those in spirit who are either affected, afflicted, or infected. I put that to you because if it is to happen, you will be the key drivers of all this. But it is a mere proposition. We are and forever will remain in your debt for continuing to lead our people on faith matters. And we are delighted that you are here to support the work that we are doing as government. But at this moment, we are also open to a number of thoughts and suggestions and proposals and propositions that you may well want to put to us. I want to promise you that whatever you propose, we take very seriously, because this is a very important moment in the life of our country. And with those words, I'd like to thank you and welcome you here to Sefako Mahato Guest House, where we are meeting together. Thank you very much. Thank you. That was the opening and the welcome. I'm now going to ask our Minister of Health, Dr. Zwelini Mkhize, to give us a presentation and an update of where we are in relation to coronavirus. We will ask the members of the media to excuse us as we are now entering into a stage where we want to have a discussion.
Guys, thank you. Sure.
Thank you, Mr. President. As we are trying to open up the